So another abstract that we want to discuss is the CheckMate 8HW abstract. Now, this was a trial for patients with MSI-H or deficient mismatch repair metastatic colorectal cancer. Now, patients with MSI-H or deficient mismatch repair colorectal cancer, we know respond better to immunotherapy than standard of care chemotherapy. There have been two trials, this trial, the CheckMate 8HW and Keynote 177, that prove this. Now, again, this is a small but extremely important subset of patients with metastatic colorectal cancer. It's about 4% of our patient population that is MSI-H. So the CheckMate 8HW that was presented at this year's ASCO GI was an investigation of combination immunotherapy, nivolumab plus ipilimumab versus nivolumab by itself, nivolumab alone. So the question being, is doublet immune checkpoint inhibitor therapy, nivolumab and ipilimumab, better than single agent? Now, I want to make this point very, very clear. When you think about the Nivo-Ipi dosing, in this trial, it was a little bit unique. The Nivo was given at 240 milligrams every 3 weeks, and ipilimumab was given 1 milligram per kilogram every 3 weeks, and that was a total of 4 doses. After that, all these patients received monthly nivolumab at 480 milligrams until progression or at the time that they discontinued. The primary endpoint of the study was progression-free survival, and the median progression-free survival was not reached in the nivolumab and ipilimumab arm and was 39.3 months in the nivolumab by itself arm. So when you look at the data, the 24-month progression-free survival was 71%. That is extraordinarily high at 24 months in the combination arm compared to 56% in the nivolumab arm. Why the study is really, really important is because we've always wondered, should we use doublet therapy up front or should we use single immunotherapy for these patients with MSI-H colorectal cancer? And this study really tells us that we should be using the doublet up front in patients that are eligible. The treatment-related adverse events were fairly, honestly, similar between the two arms. There was a slight increase in toxicity in the combination arm, which would be expected. But when you look at the overall response rates, it was 71% in the combination arm versus 58% in the nivolumab arm. So both of these patient subsets, they did great, but it's clear that Nivo plus Ipi did better. And our patients with MSI-H colorectal cancer will be starting with combination therapy up front if they're eligible for it.